The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, today on Aging Horizons we're going to be talking about independent living. Now, you may not ever have thought of that. You might have thought you were just fine, but guess what? There is some great resources out in our communities, and they are called independent living centers. They do all kinds of great sort of resources for people, and they help them with transitional living, etc. We have a lot more to tell you about, so please today stay tuned.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
It's been 27 years. I never thought I'd still be smoking, but here I am, COPD and all. I'm about to have a granddaughter. There's so much to show her, but I'm scared I won't be able to keep up like I used to. I kind of gave up on myself on quitting, but it's different now. I want to be here for her and for my daughter.
Summer in Montana is a great time to visit your local farmer's market. Enjoy the social atmosphere while shopping for a wide variety of fresh, locally grown produce. Together with both WIC and Senior Farmers Market nutrition programs, you help feed your family 5 or more daily servings of fruits and vegetables for better health. You also help local ag producers and enhance the state's economy. So, for summer fun that's nutritious and helps Montana's economy, shop at your local farmer's market.
I'm Attorney General Tim Fox. Nowadays, all of you have to worry about cybersecurity. Something as simple as visiting pirate websites can put your computer at risk. Hackers use pirate websites to infect your computer and steal your ID and financial information, or even take over your computer camera without you knowing it. Don't let hackers into your house. Be careful with the websites you visit and warn your kids on how to stay safe online. To learn more, visit my website.
Hello everyone and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimi Everman, and like I said in that open, we have a great show for you today. We're going to be talking about independent living, and who doesn't like the sound of that? You know, as we age, and I'm feeling it myself, I'm feeling places where I need a little more assistance than I used to. And if you're one of those people, this might be the show for you today. We really want you to get the information that you need to live your best life. First of all, we have Allison Alvarez. Allison, welcome. And Allison, you are the Quality Assurance Resource Specialist at MILP, which is the Montana Independent Living Project, correct?
Yes.
Well, welcome. And Joel, you're Joel Peden, and you're an advocacy coordinator for MILP as well.
Correct.
And again, that's the Montana Independent Living Project. And although for our Helena viewers, you guys are based in Helena, but we have some independent living centers around the state, don't we, Joel?
Yeah, we do.
Can you tell us?
Sure. There's actually 4 independent living centers. We're each our own nonprofit organization.
Okay.
And we divide the state up.
Okay.
So Summit Independent Living Center is based in Missoula, and they kind of cover the western part of the state. Montana Independent Living Project, we're in Helena. We also have offices in Butte and Bozeman, kind of go all the way down, Deer Lodge, down to the south, and out to like Livingston.
Mm-hmm.
Living Independently for Today and Tomorrow, which is known as LIFT,
right,
is in Billings.
Okay.
And then up in Great Fall is North Central Independent Living Services, and they kind of serve that northeastern part of the state.
Great. So just so that we don't confuse folks, we're going to put up your number, and if they do want to get a hold of one of those other places and can't figure out how, you'll refer them on, correct?
You bet. Yep.
Okay, great.
They can
That's
call
good
us
to know.
anytime.
Okay, good to know. Well, Joel, why don't you just tell us a little bit about the Montana Independent Living Project? What are they all about?
Independence.
Yeah.
Right? Being able to live in your community and about choice. Right? We always say just because you have a disability or you're struggling in an area doesn't mean that you've given up the choice to take control of your life. So where you live, or what you do for a living, or where you volunteer, whatever it is, medical care. It's all about trying to make sure that people understand how to advocate for themselves.
Exactly. And as you said, keep some choices in their lives when they are faced with some major challenges, a lot of these folks, correct? Physical and mental.
Yes. And and so many times where people struggle is not knowing the right question to ask. And my elevator speech for independent living is, if you have a question, anything to do disability related, okay, whether it's program or Social Security, and you don't know who else to ask, that's when you call one of our centers. And
great.
We may not be able to provide you that answer right away, but we'll get there and we'll get you pointed.
Coming from a no wrong door background myself, I applaud you, because there is no other way to do business. It's too confusing, and when you're coming at it with challenges anyway, So it's good to hear that, Joel. So Allison, let's bring you into the conversation for a minute. You're working with a program that's very near and dear to independent living, and that's the self-directed program. Now, we're going to go into that more deeply in our next session and talk about it a little bit more, but just talk a little bit about what do you do on a daily basis for your job at the MILP?
Sure. So I'm the Quality Resource Specialist, and I supervise the self-direct team who facilitates that program at MILP.
And self-direct is a way, tell me if I'm wrong, a way for a person who needs services to make their own choices and be empowered and in charge of it. Correct?
Definitely. So when somebody is on the self-direct program, they are able to hire who they want to work for them, to complete bathing, dressing, hygiene, shopping, anything like that. They can hire who they want. They can schedule their employees when they need. There's a lot of choice and empowerment in this program.
And so someone that they've never laid eyes on before doesn't show up at their door, they get to interview that person, decide if they make a good match or fit, and then kind of hire them on their own then.
They are in charge of finding their own person. So they can do that a number of different ways. They can go to the local job service. They can advertise their position and just hire who they want. They can hire friends or family. Whoever they trust.
And I was going to say, do you feel like folks do want to do that, friends or family, frequently because they do trust them so much?
Definitely.
Yeah, and one good thing about the program is that's allowed.
Yep.
Right? And I think that, I don't know a whole lot about the program, but I did some research, so I want to hear a whole lot more about it. But folks, we're going to talk about this when we get back in our next segment, all about what self-direct programs really can be in your life and do for you. They're a way, as you have heard, of having choice, of having direction in your life that you set up, and just an opportunity for you to be empowered every moment of your life. When you have a disability, you may feel cut off from the rest of the world, and self-direct is one way to get someone in there that you want to work with and Your choice. So please, we have a whole lot more. Don't go anywhere.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Questions about Medicare and other types of insurance? Contact the State Health Insurance Assistance Program office to get answers to questions like, what is the difference between Medicare and Medicaid, and how do you decide if you need Medicare supplemental insurance? This insurance counseling program is not a sales program. It is available to provide answers to your insurance questions. For more information, call the State Health Insurance Assistance Program office at 1-800-332-2272.
Cook foods to the right temperature using a food thermometer. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Hi everyone, and welcome back to Aging Horizons, and we're here talking about independent living today with a couple of folks from the Montana Independent Living Project. Joel, let's start with you. We were talking a bit about self-directed services before we left, but I really want to give our audience a real full picture of what that is. Let's talk about it.
Sure. So self-directed services are an option for somebody who qualifies for personal care attendant services through Medicaid.
Right.
And there's medical qualifications and there's determinations on what services are available for you.
Right.
But it was something that was developed in Montana. We were one of the first states. Wow. And that was back in the mid 80s, and the independent living centers, along with other advocacy groups, looked at the landscape of Montana and being extremely rural.
Yes.
And the difficulty, if you didn't live in one of the major cities, of finding an agency, an agency to help provide that person to come into your home. Sure. and allow you to stay independent.
Sure.
When you move out, right, and you're in Big Sandy or Ekalaka, right? It can be difficult. The other thing that we saw was that many times it was a family member that was doing that, providing those services, but they weren't getting paid for it, and so the family suffered financially because somebody couldn't go out and work. Right. So with a lot of work in the legislature and with Department of Health and Human Services, the self-direct program was developed. And what that does is it gives somebody two choices. We talked about choice earlier, right? Somebody can elect to go with the agency services, and the agency takes care of finding and hiring and training. Or if they have the ability, they can also choose to go the self-direct route. And that is kind of like a co-employer type of a situation. So they have to work with an agency such as MILP or any of the other independent living centers, and there's also other agents, other groups that provide that service.
Okay.
And I'll just use MILP for an example.
Sure.
So MILP kind of serves as the human resources department.
Oh, okay.
Okay.
Sure.
So that our group handles all the hiring paperwork, right? We process, we do payroll. We make sure that they're in compliance.
Super.
With, so and then the person on the other hand, they're in charge of hiring, training, firing.
Sure.
Because the whole idea is they know what they need done.
Right.
And so it's really, it's a relationship that develops, and it's a great option for somebody.
And one of the things that I read in some of the research that I did on y'all was the person-centered planning process that goes into this, because that's very, I'm going to say it's very popular now, but it's an important popular paradigm shift, I think.
Yeah.
Because it's talk about that a little bit and why that's important in this process.
So I'm going to defer to Allison.
Oh, okay.
That, right? Because this is her specialty.
Okay.
Right. So the person-centered planning process is very important, because that's when we sit down with the person who's about to direct their care, and we talk about what they need, what they want, their goals, and how services can help support those goals. We talk about backup plans, what someone will do if their caregiver doesn't show up, and so we can have some plan Bs in place, some plan Cs.
Well, and person-centered planning is really the gold standard now. It really is, and we want to make sure, I think the baby boomers really brought that to the forefront, because we were used to having lots of choices. And so this is a process that really helps that person step in and be empowered, right?
Yes.
And get to make a lot of their own choices, but have support from you.
Right.
Great. Right. So do you have a lot of folks that want to pursue this?
We do. We get referrals all the time for people wanting to self-direct. They call us, and we do just a screening basically over the phone. We see if they want to, if we talk about agency-based service and self-direct, so they can make an appropriate choice for themselves. And then we'll come out and do an intake if they choose.
Okay, and just keep them sort of rolling along, because it looks like you have service plan, you do a budget?
No, we don't do a budget. That's more on the waiver side, but we are there at those meetings as advocates if needed. Okay,
because the person is getting so much to help pay for the services, correct?
Not really through our program, but
through the waiver.
Waivers.
Okay.
Yep.
Okay. Very good. Well, it sounds really like a wonderful sort of service, and I bet you do get a lot of people that want to be involved. Joel, I don't know. What do you think? Is this probably one of the best things you work on, these self-directed services?
You know what it is. It's all about home and community-based services, allowing somebody to stay into their home and get the services that they need. Number one, financially, it's less expensive than if they have to move into a nursing home or whatever the next level of care is.
Right.
And also one of the services that independent living offers is transitions. So if somebody's in a more restrictive environment, and let's say they're in a nursing home, and they decide they don't want to be there anymore, we can assist them in moving out
on.
And moving back out into the community.
We're going to talk some more about that, because I'm excited about that. Be right back, folks.
I was diagnosed with diabetes in 1992, and I went into denial. It made me angry. I was a professional chef, and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
Good care is your right. In Montana, there's over 11,000 beds in nursing homes and assisted living facilities. If you or a family member needs assistance or help in obtaining information about care issues and placement options, call 1-800-332-2272. If you or a family member need information about Montana's long-term care resident rights, or if you need help solving a problem or a complaint about a nursing home or an assisted living facility, call us at 800-332-2272.
If you give or receive care, you already know that it can cause stress on caregiver and receiver alike. The good news is, if you have limited resources, help is available. The Montana Lifespan Respite Program may be able to help you pay for care while you take a break. Even better news is how easy it is to apply. You can get an application online or have one sent to you. We'll get back to you within 5 working days. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
If the Aging Network in Montana was a restaurant, the sign out front would say, over 50 million meals served over the last 30 years. Since adequate nutrition is critical to health and quality of life, nutrition services are an important factor in keeping older Montanans healthy, independent, and living in their community and home. To find out more about senior nutrition programs in your area, call 1-800-551-3191.
Hi folks, welcome back to Aging Horizons. We're here talking about the Montana Independent Living Project today. Joel, before we left our last segment, we just sort of teased the audience a little bit with some discussion about transitional health. Now, this was a big surprise to me, so please tell us what that's about in terms of your organization and transitioning folks.
Sure. So a couple of years ago, Congress passed some new workforce laws, and in there is where the independent living movement is housed, and they added a 5th core service to what we provide, and that's transitions. So it's transitions on both sides of the age spectrum. So we help high school students who are getting ready to graduate and move on to some sort of a career or college. We help them with planning with that. On the other end, we help people that are either at risk of going into maybe a nursing home or an assisted living, which is, it depends on where it's appropriate, right? But maybe they don't want to have to go there yet.
Yeah, right.
And so this is where we can help them come up with some ideas and what programs might be available to them based on things like, their financial ability or who their insurance company is, whether they qualify for Medicaid, all those qualifiers.
But in order to help them be independent with supports.
Yes.
Okay. Awesome.
Yep. And help them be able to identify that.
Right.
And then if somebody wants to transition out, right, or let's say somebody fell and broke their hip, and as part of their rehab, right, they go into a rehab facility, but they need to make sure that they have those supports in place
when they come out,
before they can come out.
That's right.
And many times people end up having to stay for extended stays, or those stays become permanent because they don't have the supports at home.
Right.
It could be as simple as they just need a ramp now.
Right.
They do need to get set up because now they've that life event has happened,
right,
and they need those extra helps at home,
right.
And that's where our independent living services can help identify those and help set those up.
Right. Now, one thing before we move into the services piece, we were talking about what makes the independent living folks kind of special in a way. Why don't you explain that?
Sure. So back in the early 70s, kind of a little bit of background in independent living, there was a group of college-age folks with disabilities. They want to go to college. So this is pre-ADA, this is pre-curb cut, this is pre-accessibility, and so it happened to be at Berkeley, University of California, Berkeley, and as they started to attend college, and it was a thing where some of them had to, their dorm room was the infirmary because dorm rooms weren't set up
Right.
for somebody with a disability.
Right.
But what they started to do was band together, and they formed the first independent living center. And it was people with disabilities helping other people with disabilities try to figure out how to go to college.
Right.
It moved back in the early 70s as part of the Rehabilitation Act. Independent living centers were created on a federal basis. There's now about 550 independent living centers across the country.
Okay.
But one of the things that kind of sets us apart and makes us unique is by federal law, 51% of our employees have to have a disability, and 51% of our boards of directors, have to have a disability. And so when you walk into our door, all the other agencies do a great job, and they try.
Right.
But sometimes you don't know what you don't know.
Exactly.
And what you haven't experienced.
Right.
And so walking through our door, our hope is that, we can share that common bond with somebody, help them relax, relieve some of that anxiety. Right. And, my ultimate goal in life is if we could have a world that viewed disability the same way that we look at people who wear a pair of glasses.
Right.
Okay?
Right.
If you wear glasses, if you take somebody's glasses away, there's a lot of things they can't do.
Right.
They probably can't drive.
Right.
Reading gets worse, right? As you age and you have to wear your reading glasses because your arms get shorter, But we don't look at somebody wearing a pair of glasses. No, nobody's ever walked up to a friend of mine wearing glasses and patted him on the shoulder and said, "It is so amazing, Kim, that even though you have to wear glasses, you still have a job, you still contribute, you have a family," right?
Right. I like your dream.
Thank you.
I like that dream. Now, before we wrap up for today, Allison, I want to bring you in for a couple of minutes here and talk about some of the rest of the services.
Sure.
Because we gave a lot of time to self-direct, but there's more things that happen at an independent living center.
There is. So we also provide information and referral. So if anyone has any questions about anything, resources, what's going on in the community, they could call and we could look at for that information for them.
Okay.
We have peer support programs.
That's a great one.
People could call and get involved with those. We do independent living skills training. So if somebody needs to brush up on some skills to be able to live independently, we can look at that and help them. And we can do so many different things as well. It's just important to call if anyone has any questions or is struggling in any area.
Because what I've said so many times on this show, nothing bad is going to happen if you call. If you reach out just to get some information, nothing bad's going to happen. In fact, something good might happen.
Right.
And if you're not eligible for a service, at least you'll find out, right?
Yep.
Well, I've just enjoyed so much having you both here today.
It's been a pleasure to be here.
Well, and I hope you'll come back and talk to us some more. Independent living has always been a real special thing to me. I know a lot of people who have used your services and have been very happy. So thank you very much, both of you, for all you do. And folks, don't suffer by yourselves. Reach out. We want you to do the very best to have your best day ever.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.